Thank you, Jonas. Whether you're returning or you're just starting, I'd like to welcome you to our falls prevention exercise class with Dr. Janson. Dr. Janson has almost 30 years experience as a physical therapist. She is board certified in geriatric physical therapy, and she understands the aging process, how it impacts balance and falls risk. She leads the Trauma Survivors Network at GW University Hospital, and she's an adjunct professor in physical therapy at Marymount University. I'd like to turn it over to Dr. Janson. Thank you.
Hi, everybody. Nice to be back this month. Really enjoyed the class last month, so I've been looking forward to doing this again today. We're going to do some exercises the same that we've done in the past, and we're going to mix in some new ones as well. Each month I'm going to try to mix it up a little bit. And usually it'll be something that's kind of current in the fall prevention research world that we'll introduce, and I'll explain kind of why we do certain exercises that we do. Just real quick before we get started, remember, if any exercise that we do, if it's painful or you're not quite comfortable with it, feel free to sit that one out. I don't want to have anybody do anything that they're not comfortable or feel that they're at risk for a fall. We're going to do quite a few things in standing. If you need to use your rollator or your walker or cane for balance, that's fine. You can certainly use the back of the chair that you're sitting in for balance. And if you feel that you can do it without holding on, that's perfectly okay as well. So whatever your own comfort level is, that you feel like it's challenging but still safe. All right, so having said that, we're going to get started with our little seated warm-up. And let's start with our shoulder rolls, and we're going to do those backwards. Good. This is a nice little warm-up. Getting those shoulder blades moving is great to help with posture. And anything that helps us with posture helps us with balance. This is a great exercise if you're doing a lot of work at the computer during the day or after sitting reading the paper. Great thing to do kind of multiple times during the day. Keep these muscles loose, keep those shoulder blades mobile. Good. Now we're going to do a neck roll. I don't think we did this one last time. Last time we just focused on bringing the head back. Today I actually want us to make a circle, and we're going to roll nice and slow. It's not abnormal if you kind of feel or hear even some pops and cracks. I have some in my own neck too. Good. Now, if anybody feels like they're getting dizzy or the room is spinning by moving their head, then stop. And let's try doing a few circles the other direction. You'll notice through the class today that we're going to do more exercises where we're moving the head. And there's a reason that we're doing that is because when we do motions with the head, whether it's forward and upward or side to side, we're stimulating our inner ear system, which is a key system that we use for balance. And it used to be a belief that that system kind of gradually became less active as people got older, but we're finding that it really doesn't have to be. So if we do exercises that involve some turning of the head, rotating of the head, that's a nice way that we keep that system active. All right, now for the next warm up, let's take some nice deep breaths. So remember we talked about this last time. We're going to sit up nice and straight. Make sure your back is not touching the chair. So you want to think about making your chest stick out as far as you can when you do that deep breath in. And then you're going to blow it out like you're blowing out a whole bunch of candles on a birthday cake. So deep breathing is something that we didn't really used to pay too much attention to, but it's come more to the forefront as we're living in the world of the coronavirus, that we want to have our lung function as optimal as possible. And if you don't periodically just force yourself to take nice deep breaths, the lungs just tend to get kind of stiff and the ribs get a little stiff. And then it becomes harder to get those deep breaths in and out. So I would encourage everybody on a daily basis, just stop and take a couple of nice deep breaths. Is a great thing that we're recommending now for everybody to try to do more regularly, and especially right before you're starting an exercise routine. Good. All right, now another good warm up that we want to do is our ankle circles. So this is the one where we cross our leg and we're going to circle our foot 10 times one way. And make sure you're just circling the foot. I don't want to see the whole leg moving, just the ankle. And now let's take that the other direction. Good, and switch direction again. And again, the other way. And if your circle doesn't look perfectly smooth like mine, don't worry about it. You're still getting the benefit of the exercise. And this is something that we find in clinic. Once people start doing this regularly, gets the smoothness of the circle gets better quick. Now we're going to do that same thing with the other foot. Good, and then the other direction. Good, back. And switch directions again. Excellent. I think I've mentioned in previous classes that ankle stability is one of the key things that we can do to improve our balance. It's something that we naturally lose as we age. This is such an easy exercise that you can do while you're on a Zoom call with a friend. You can easily do your ankle circles, watching the news. It's an easy one to sneak in if you're waiting for an appointment, like at a doctor's office. I would recommend trying to do this once a day, doing those ankle circles. It keeps the flexibility in the ankles and it keeps the muscles strong. Now I also want to do just a regular up and down pump, and that's just in sitting, pumping the feet up and down. Good. We're going to do that about 10 more times. Okay, perfect. Nice job, everyone. So now we're going to go ahead and stand up. And again, feel free if you have a back of a chair that you can hold on to if you need to for balance, or hold on to a rollator or a walker, that's perfectly fine. We're going to start with a march in place. We did this last month. We're going to march for about a minute. And if you need to hold, that's perfectly fine too. Good. If you feel like you need to stop because you're getting short of breath, feel free to stop. We have about 25 seconds to go on this one. All right, good job, everybody. That brought us to a minute. And now I'd like to do kind of another march, but this is going to be a sidestepping one. And feel free, if you want to have the chair in front of you to hold for balance, that's fine. But what we're going to do is we're going to step side to side. And if you wanted to make it like you got a little rhythm going, feel free. Make it a little bit more interesting. Again, something you could do on your own if you had some music. It's a nice weight shift side to side. Now, some of you may want to just stick with doing the step side to side. Some of you that want to make it a little bit more challenging, we're going to touch to the back. Right, you're lifting your foot up and touching it with the opposite hand. Again, if this is not quite comfortable for you, just hold on and do just a side step or just a march in place. And about 10 more seconds. Terrific. Very good. All right, let's everybody sit back down. And I'm going to have a quick drink of water if anybody needs a quick drink. Now we're going to do the exercise that I think I've done every time when we've met, that one where we stand up and sit down 10 times in a row. I want people to pay attention when they're doing this, to think about what we call nose over toes. So we're going to lean our body forward as we stand up. We're going to lean our body forward as we sit down. If you need to push up with your hands, feel free, but try to see if you can do it without. So this is 1, 2, 3. And the idea is to sit down nice and slow and controlled. 4, 5. If you have bad arthritis in the knees and this one hurts, then skip this one. 7. Nose over toes. 10. Okay, I'm going to rest just a second. And then I'd like to do that one again. But if you find that this one just really doesn't feel good on your knees, what you can do as an alternative for this one is just kick the leg up. You could do 5 times on one, 5 times on other, while the rest of us are doing the up and down. So we're going to do that sit to stand again 10 times, nose over toes. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. Okay, I hope that felt okay to everybody. We see it a lot in the clinic where people stand up and then they almost fall down in the chair when they go to sit. You can really hurt your back doing that. And so getting used to that leaning forward, bringing that nose over your toes as you sit can make such a difference in the safety and the control of going from a standing to a seated position. Okay, so now we're going to stand up again and we're going to hold on to the back of our chairs. Make sure. And we're going to start with the one where we kick our leg to the back. Make sure you keep your back up nice and straight. I don't want to see people rocking forward. So it's just a kick back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we're going to do 10 with the other leg. 2, 3. If you feel like you can do this no hands or one hand, you could make it more challenging. And we're going to go back to the leg we started with. I started with my left. 2, 3, Good, and then the other leg. 4, keep your back up nice and straight. And 10. Perfect. And now we're going to do one that's similar. Have the chair in front of you so that you can hold on, or you can use your walk or your rollator. And you're going to swing your leg out to the side. So 1, 2, and you see how I'm keeping my body nice and still? We shouldn't be rocking on this one. Try to keep everything here nice and still. Good. If you need to hold on with both hands, hold on with both. If you can do it with one, that's more challenging. If you can do it no hands, that's really good. Good. And we're going to switch again to the other leg. And then to the left. 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, doing that no hands the way I just did it, that's pretty hard. You know, anybody over the age of 65, we really don't expect people to be able to do that. So don't feel bad if you had to hold with one hand or two hands. That's pretty much the norm. All right, now we're gonna do, we did this one last time. We're going to start by raising up onto our toes. And if you want, you can stand on one leg and do one leg at a time. It's a little bit harder. So I'm going to show the first set doing both. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now you can keep going with that one, or if you wanted to try to stand on one leg. And let's try it on the other one. And 10. Good. Kind of shake it out a little bit. And now we're going to do the reverse of that one. We're going to rock back on your heels and try to lift your toes off the ground. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. We're going to do another 2 sets of those. This is probably one of the most important ones in the whole series, especially living around here where the sidewalks are uneven. Having strength to make sure your toes come off the ground can help you avoid a lot of trips. was our second set. And make sure you try to stay up as straight as possible. We shouldn't see you really do a big lean like that. The body stays pretty straight. And 10. Perfect. Nice job, everybody. Let's take a seated break a minute. So we've done our warm up. We got everything loosened up with our shoulder blades and our ankles. We got our heart rate up a little bit through our marches. We've done our strengthening exercises, those last couple that we did, the swinging to the back, the repeated sit to stand, the heel raises, the toe raises, all of those are aimed to strengthen the main muscle groups that we use for balance. And now we're going to finish with a bunch of exercises that are specifically targeted towards balance. So the first one that we're going to do is called a 4 square. And what we'll do for this one, again, if you need to use your chair for support or your walker or a cane, please use it. Imagine if there was a square on the floor. You're going to step forward, you're going to step sideways, you're going to step backward, and you're going to step back to the left. So take a step forward, take a step to the side, take a step to the back, and over. If we do this in the clinic, we actually put canes down on the floor so that people are having to step over something. So lift your feet, step forward, step to the side, step back, step to the left. Again. Back, forward, side. If you need to hold on to something when you step back, please do. A lot of times we see clients who really don't like that back stepping component of this one. Imagine you're stepping over a cane or a newspaper or something on the floor. It doesn't matter which leg goes first when you go forward or backward. That's not important for this one. All right, now we're going to do the same thing, but we're going to take the square the other direction. So over, forward, sideways, and back. Over, forward, sideways, and back. Over, forward, sideways, and back, and over, forward. Good. We'll do a couple more of these. And let's do one more. Good. There's actually a standardized test that physical therapists will use if we're trying to determine if somebody's at risk for falls, and it's called a 4 square step test, where we would actually have you do this for a period of time, count how many times you can go around, and then that would give us some objective data if somebody's at an increased risk for falls. So I hope everybody felt okay with that one. Again, please hold on to something if you need to for those. Now let's try balancing on one leg. We did this last time. So we're going to hold on to our chair. We're going to pick one leg up. And then we're going to try to let go. And we're going to see, can I stand here for as long as 20 seconds? If you need to put your foot down, that's fine. Then just pick it back up and start up again. And if you can only go 1, 2, that's still training that balance system. If you can hang out here the whole 20 seconds, that's terrific as well. Good. Rest a minute. We're going to do that again on the same leg. So again, if your foot goes down and you lose your balance, fine, then just start back up. If you feel your ankle moving a little bit, you can even see it on mine. That's normal. That's a way that we strengthen our ankle muscles, work our balance systems. We'll just make sure. Okay, let's do that again. Excellent. Okay, now we're going to do it on the other leg. Pick the foot up and try to hold it. And we talked last month about if you can do this during your day, like if you're waiting for the elevator or if you're brushing your teeth, washing a dish in the sink, if you can practice doing that on one leg, it's a great daily routine to help keep your balance in tip-top shape. Rest. Try again, try to balance. Remember, if you have to step down, just try it again. Start back up. Good. And let's do that one more time. Okay, nice job, everybody. Good. Let's take a seated rest break a minute. Okay. So now we're going to do a couple of new exercises that we haven't done in previous classes. And again, these are designed to kind of get the head moving a little bit more while we're doing an activity, because we're trying to stimulate that inner ear system, since that is one of the 3 main systems of balance. When I've come to talk about specifically like fall prevention strategies, we've talked about those 3 systems. It's the inner ear, it's our eyes, and then it's our position sensors in our feet. So we've always talked about you want to try to have sturdy footwear on. If you have problem with a lot of swelling in your ankles, make sure you talk to your physician about that to see if there's anything they can do. If you have neuropathy, which a lot of us do, then that's something to be aware of, that your balance is not going to be as good because of the neuropathy. And that means we have to be extra careful. Maybe that's a reason to be using a cane or a walker. Then our eyes are super important for balance. That's why we never want people to get up at night to use the restroom and have it be completely dark. Make sure you have night lights, or make sure there's enough light from the street coming in that there is some light. And then that last system is that inner ear system. And the way that we keep that active is through head movements. And I just listened to a lecture last week where they took a group of seniors, and they had a group of seniors that were distance runners. These people were still running. And then they had a group of seniors who were into weightlifting. And so these people were bending and straightening and doing weightlifting, but the kind where you actually, lift a barbell. And which group do you think would have the better balance? Well, I thought it would be the runners because they're running all the time. It was actually the weightlifters, and they speculate that because they're doing more of an activity where the head is moving more, they're training that inner ear system more than a runner who's just doing a little bounce up and down as they're running. So I took that to heart and thought about some of the exercises that we do in the clinic for balance. And I thought this makes sense why we do a lot of things that involve head movements. So let's stand up. And again, if you need to have your chair or your walker, please hold on to it or hold on to it with one hand. If you can move your hands out, legs are about shoulder width apart. We're going to twist to one side, come back to the middle, bring your arms down. Arms up, twist, come back. Even if you're not comfortable doing this standing, do it seated. You'll still get the benefit of that head movement if you do this in sitting. And we're going to do one more to this side. Perfect. And now we're going to do it to the other side. Good. We're going to do, this is number 7 to this side. Nine. And 10. Very good. If any of you know somebody who has Parkinson's disease, this is a popular exercise we do with that population as well, specifically for balance. And I like the carryover of the twisting because of the head movement.
May I ask a question about that exercise? When you were twisting, I couldn't see your legs. Was your opposite leg?
Yeah, let me show you.
Turning.
I'm glad you brought that up. So when you do that one at home, your feet can twist with you.
Oh, okay. Yeah.
Right? You can just kind of like a golfer would move their leg when they're twisting. Don't feel like your feet have to stay planted.
Yeah, because I was feeling that in my knee on one side.
Yeah.
Right. Thank you.
Yeah, that should help with any stress on the knee. And remember, you can do that same motion in sitting and still get some of that benefit. All right, so now we're going to try one. And this is also a kind of a Tai Chi pose. Let me see if I can get enough of my body in the screen. What we're going to do is we're going to step out to the side and we're going to bring our arm out. And the key is that we're going to turn our head with it. Good. So you're looking forward and then you're looking to the side. Good. One more time to this side. Perfect. And let's try the same thing to the other side. The arm goes out as we take a step and we turn our head in the direction that we're stepping. 3, 4, 5. And even this one, you could do this same motion seated. 7, 8, 9, and 10. And that's an exercise, again, that we use a lot with our Parkinson's population, but it really is a popular movement in Tai Chi. If you've ever seen people doing the Tai Chi in the parks, that is a common kind of weight shift. And I like it because it has the head rotation with it as well. So the last one that I want to do is a backward step. This is a little bit tricky. So what you're going to do is you're going to step backwards. And as you step backwards, think about taking a bow.
Are you bending your front leg?
Let me give you a little bit more view of my legs. So you're bending the leg that you step back with as you're taking that bow. You can hold on to a chair or hold on to something in front of you, a table. But the key is to get that upper body bending forward like you're bowing to the queen. One more time on this side. Okay, now we're going to do that with the other side. Good. Now, I hope nobody had real symptoms of dizziness or vertigo while they were doing those motions. Sometimes people do have some deficits in the inner ear system where things like that could actually make them quite uncomfortable. If that was the case, I would really recommend talking to your physician about that. And seeing if we could see you in the clinic specifically to treat that. Because if you notice, if like anytime I bend over and come up, or anytime I'm moving my head side to side, everything is starting to spin, that needs some medical attention. All right, I think we have time for one more exercise before we open it up for questions. And this last one, we did do this last week. This is the one where we're going to stand with our feet one in front of the other. So one foot in front of the other. And then see if we can let go and hold that position for about 20 seconds. Very good. Now let's switch. If this was super easy for you, you could try closing your eyes, but that gets really hard. So make sure you're doing that next to a counter or in a safe situation. Good. We're going to switch feet again.
is your weight distributed equally on both feet?
So mine is, but it doesn't matter if you feel like you need to be more on your back foot or your front foot. That really doesn't matter. Good, and we're gonna switch one more time. Okay, all right, nice job, everybody. Let's sit back down. I want to make sure we have a little time to answer questions.
There's one question that came in through the chat. Someone asked about your shoes. Do you have any specific special shoes?
No, and you know, I think any shoe that's a supportive shoe, whether it's a slip-on, a lace-up, a Velcro closure, you know, the shoe should fit. Sometimes we see people come in the clinic where the foot is sort of swimming in the shoe. You know, we don't recommend that. We are not fans of Crocs. Those were real popular a couple years ago. Again, there's a lot of movement of the foot within that particular shoe, so it should be a little bit tighter. Shoes that are really cushiony. One of my patients brought up a name of a shoe. I think it was called a Gravity Defier. That's a nice shoe if you're standing for 8 hours on your feet, if you're a nurse or a teacher and you're standing. It's not a great shoe for walking because it's too cushiony. And when we stand on something that's soft, that can actually make our balance a little bit worse.
Great. Someone asked, they missed the first exercise you said was so critical. Do you mind just briefly showing that just once? The neck rolls, or before the neck rolls, they said.
Was it the ankle circle? Was that the one that?
I'll also make sure they get the video. I should say that. So if they miss the exercises, I'll make sure everyone gets the video and they can repeat at their leisure anything that got missed.
The first exercise was the shoulder back stretch.
Yes, so the first one was the shoulder roll. And that, you know, I think that is a great exercise to do for everybody because it helps us with our posture. Whether or not I would say that that's the most important one for balance, probably not as important as some of the others, like the ankle circles. I could make a case that really is a more important one to make sure you're doing on a daily basis to help with your balance.
Great. We had a couple more that came into the chat, and then I saw there's a couple people that seemed like they want to ask questions as well. Someone asked about, they have a problem about tripping on uneven sidewalks. Any exercises that help in terms of picking up the feet?
Well, so really everything that we did today is going to help with that. Those strengthening exercises where, you know, we were just swinging our leg out to the back and out to the side, what that allows us to do is it allows us to be better at shifting our weight to one side, which allows you then to pick up the foot. Usually people think that I'm tripping because I'm not lifting my leg up high enough. What we find as physical therapists is that oftentimes you're not shifting your weight onto your stance leg enough, and therefore you're not able to pick up the other side. So keeping your strength up through the strengthening exercises is key to be able to pick the foot up for not tripping. So kind of that middle section of the video, you know, we did the repeated sit to stands, we swung the leg out to the side, we swung the leg to the back, we raised up on our toes, and we rocked back on our heels. Those 5 would probably be the best to help you be able to shift your weight to clear your foot.
Great. One more question, then if there's anyone that wants to ask a question from unmuting, we can do that, but there was one more from the chat. How many times do you have to do the 4 square exercise to make that a low risk of falling? what are the as you mentioned, that was one of the exercises you do in intake.
You know, I don't know that cutoff score off the top of my head, but that's something I could certainly look up, and I could email it to Nadia if she wanted to share that with the group. If you wanted to know like the actual numbers, like to challenge yourself, I could find that information out. I don't know that cutoff score off the top of my head.
Okay, thank you. I noticed Jane and Sally were both. Jane, do you have a question?
No, I was just going to say that I think the exercise you said was very, very, and maybe most important was the rolling back on your heels.
Yes, yes. So
For your ankles, yeah.
Right, when we were standing,
Yeah.
and you rock back on your heels, right? Because what that does is it strengthens these muscles on the front, the ones that lift our toes up. So you want to have good strength, that you are clearing any of those unevennesses.
Great. Sally, did you have a question?
I have a question, and my name is Sally.
Yes.
A neighbor of mine is 87, and he's been tripping a lot and falling. And he doesn't use a cane, and he's 6'4". And I'm very concerned about him. Do you recommend canes or walking sticks for older people? And is there any other suggestion?
Yeah, so anybody that's having frequent falls really needs to address that with their physician, and they really should come in and see us in the clinic so that we can do a detailed assessment on what the cause of the balance impairment is. But certainly, if you've had a fall, you're at a much higher risk for having another fall. And you're at a much higher risk for having what we call an injurious fall, so a fall that's going to result in a broken hip or some other type of fracture. So please ask him to get some help. And sometimes the trekking poles are perfect, but not for everyone. So I can't really say what would be the best device for him to use, but an evaluation would be highly recommended.
So a walking stick or cane is not indicated right now. In the meantime, he's resistant to going to see people with COVID.
Well, we can see people virtually too. So we could do a telehealth visit.
Well, how would he go about doing that? How would he contact you?
So he would need to reach out to his physician,
Right.
and we would need an order from the doctor.
Okay.
And then we call all our patients before we see them to see if they're interested in a telehealth visit instead of coming into the clinic.
And your particular clinic is GW, isn't
Correct,
it?
right.
Mhm. Okay.
Yes. Well, thank you. There was a couple more questions, so I wanted to get to that. Thank you for that, though. I think BJ had a question. If you want to ask it, I can ask it for you, or you're unmuted, so you can ask it yourself if you like.
When I'm trying to walk, I can't stand up straight. I tend to bend forward as I'm walking forward. And I've been trying to correct myself, but I just can't move without bending forward.
Yeah, so that could be a number of things, but most likely there is some weakness in your back and in your hips. So that exercise, BJ, that we did where you're standing and swinging the leg back behind you.
Yes.
Yeah. This one is going to, so normally if we're here, we need these muscles here and here to bring us here. So focusing on that one. And if your joints allow you to do that repeated sit to stand, that works those same muscles. So that would be one to focus on.
Great, thank you. There was one more question that came through the chat, but definitely want to say thank you for joining us, and I hope everyone joins us at our next program in March. We have two more of these, one in March and one in April, both spaced out about a month, and I'm sure Nadia has a word, thank you word to say too, but I'm going to ask this last question and then pass off to Nadia. What is your opinion on the use of ankle weights?
So if you were doing a seated exercise, ankle weights are fine. The standing ones where we're swinging out to the side or to the back, ankle weights are fine for those. What we don't recommend is to put ankle weights on and then go for a walk with ankle weights. We don't recommend that. That used to be kind of a popular thing, like in the 70s, 80s. Don't do that. That pulls pressure on the joints in a way that's not normal and could lead to injury. So again, if you wanted to do those swings out to the side or out to the back with a 2 or 3 pound weight, that would be fine. Don't go for a walk with weights around your ankles. And Nadia, maybe if you can ask people in an email follow-up, if they feel that these are too hard, you know, maybe share that with me, then I can make it a little bit easier. If people feel they're too easy, I can also go the other direction.
Thank you. I just wanted to remind people that March 10th will be our next session. Same time, same place.
Looking forward to it.
Thank you so much.
I wanted to thank you all for these sessions. It's Roseanne, and I highly recommend this PT because I did fall therapy with her. I was falling a lot. And it was after I fell 16 times. I'm sorry, 11 times in 2016, mostly because of Donald Trump, that I started going to her.